But now we will first go to Dr. Mohammed Salim Bahadouri from Afghanistan. Welcome, and the floor is yours. You can start.
Hello, good afternoon, everybody. This is Dr. Salim from Afghanistan, MCH Project Manager from MCH of Ministry of Public Health. At first, let me to thank for all organizers that prepared this opportunity that we share progress, achievement, and challenge regarding MCH project in our country. And the first slide that you see MCH Handbook initiative as a tool for continuum of care and universal health coverage in Afghanistan. And the picture that you see, the first picture show the cover page of MCH Handbook, and the second picture show the difficulty of and problem in Afghanistan that show this picture, transfer of the patient from mountain and snow, during the snow from far from village to health facility. And the outline of our presentation include of country profile, MCH Handbook initiative in Afghanistan, MCH Handbook content, implementation modality, capacity building, how that MCH Handbook enhance coordination between distributing point at health facility, continuum of care by implementing MCH Handbook, universal health coverage through MCH Handbook, lesson learned, success story, costing, challenge, and next step. This slide shows the map of our country, Afghanistan, including 34 provinces, and Afghanistan located in the heart of Asia and includes 34 provinces. And total population is 13 million, growth rate is 2.6, life expectancy 62 for men and 64 for female. MMR 661, and under 5 mortality 55, IMR 45, NMR 22, CPR 23%, and T4 5.3. Delivery by skilled attendance 51. And MCH Handbook initiative in Afghanistan, and at first concept brought by a team from Indonesia in 2015. Contextualized and field test by technical committee in 2016. Pilot designed by based on lesson learned of other country and implementation in 2 districts by support of JICA from August 2017 till July 2018. Evaluated by third party, and national scale up started from 2019 by issuing a decree by Ministry of Public Health. Continue the next slide. MCH Handbook consists in 2 parts: maternal health and child health. Maternal health, pregnancy, delivery, postnatal. And this part include health message, illustration, health record, ANC, delivery, PNC, family planning, and TT card. And child section from birth to 2 years child. It includes health message, illustration, health record, vaccination card, growth monitoring, and these are the sample of card, ANC, PNC, childbirth, and vaccination, as well as nutrition card. Record card. Implementation modality and phase-wise scale-up, project management team, at the central level at MOPH, provincial coordinator, and implementing NGOs, and as well as provincial public health officer team. And scale up at the first phase started 2019 for 3 provinces. Then second phase in 2022 include 8 provinces. Third phase that we are now in place in 2021 national-wise, which is include 23 remaining provinces. At first, capacity regarding capacity building training, microplan developed, tutor training for technical team of provincial public health directorate and implementer NGO, initial training for healthcare provider, midwife, vaccinator, nutrition counselor, and head of health facility, tutor training for community health supervisor, CHS, and orientation workshop for community health worker has been conducted. Distribution rate through distribution point for pregnant women and children under 2, as you see in the schema. And percentage of MCH handbook distribution through distribution point by midwife 50%, and by nutrition counselor 17%, and by distribution point by vaccination 33%. And the main remarkable issue, retention rate is 99.3%, and redistribution 0.7%. And how did MCH handbook enhance coordination between distributing point at health facility? Coordination between distribution point that you see MCH section, between nutrition and nutrition, between immunization section. In this coordination, interdepartmental coordination is improved, regular referral, tracking of missed service by each department, and minimize missed opportunity as well. Continuum of care by implementing MCH handbook. MCH handbook tracks service during pregnancy, childbirth, and afterbirth, which is include antenatal care during delivery, postnatal care, vaccination, nutrition service as window of opportunity during first 1,000 days of life. And as you see in the picture, by each service that service provider provide to the mother or children, for each service, and the one flower colored in MC section and EPI section, as well as in nutrition section that you see in the slide. Universal health coverage through MCH handbook, distributing MCH handbook through public health facility, adapting community-based intervention like family health action group, distribution of MCH handbook through private sector at next step, and health facility provide this kind of service, counseling for the client, NC delivery, PNC family planning, vaccination, IMCI services, as well as growth monitoring and promotion at health facility level. At house, at health post, home visit, health education, community growth monitoring, and referral. At household retention, valid source of health information at the family level, birth certification and immunization. Monitoring, as you see in the picture, accelerated monitoring plan developed, joint monitoring with provincial public health directorate and national NGO as well. And this picture shows the joint monitoring, which include from BPHS implementer, and as well as from MOPH and MCH handbook team. The second picture that you see, individual monitoring conducted from the health facility and asked from the mother how that receive the information through the MCH section. Review workshop conducted for phase 1 and phase 2 of province at provincial level. And during this review workshop, the progress of MCH handbook implementation from related provinces discussed and challenge defined and discussed the solution way for phase 1 and phase 2 provinces. Promotion of MCH handbook, as you see in the picture, Facebook page and Viber group created. We share our activity at provincial level and challenge progressive MCH handbook in Viber group as well and Facebook. MOPH decree sent to all provincial public health directorates and implementing NGO. MCH handbook article published in the BMC Public Health Journal. An article on MCH handbook presented in the FMIC 9 International Conference. MCH handbook presented in Health Assembly. MCH handbook dashboard created in DHIS to monitor the distribution of MCH handbook at national and subnational level. This is this picture that you see there. This is the dashboard that show the training activity in this picture. Lesson learned: involvement of professional associations such as Midwifery Association and necessary for successful implementation of MCH handbook. More focus on training of healthcare provider will minimize the confusion during the distribution of MCH handbook. And that we prepare a few guidelines for better implementation and distribution of MCH handbook through healthcare provider for the client. And also we have prepared education film and show during the training for healthcare provider. Involvement of community will promote utilization of MCH handbook, especially male involvement in maternal and child health. Coordination at the central, provincial and community level. Success story during the distribution of MCH handbook: a mother having MCH handbook in their hand and at corridor of the health facility and waiting for getting health service from MCH handbook section. When the monitor asked who is the this book belong to, she responded, "It's belong to me." The monitor asked her, do you know the content of this book, and have you ever learned anything about health of mother and child from this book? She said, yes, since I am studied primary school and I learned from a written message as well as picture of the book. For example, during my previous pregnancy period, I don't know regarding care of pregnant woman and jump from stair to the ground. And unfortunately, I do miss abortion. And when I got the book and read it, especially regarding the take care of pregnancy period for the pregnant woman, I follow the mentioned important message. Now, fortunately, I have healthy infant. This is the sex story, and we have a lot of sex story regarding MCH handbook implementation. Costing total contribution USD around 8 million, total programmable amount around 7 million, total fund utilization around 5 million, and fund utilization as a percentage 73%. Challenge: anti-government elements prohibit MCH handbook distribution in some provinces. Before we have during the many discussion, we solve it, and still now we have this kind of problem, like some provinces that name is Paro, Nuristan, and Kunduz as well. And security challenge for conduction of TUT for a provincial team at zonal level. And geographical and climate issue, as well as the other challenge that we faced during the implementation. And coronavirus pandemic, as you know better, that affect all health section, include of MCH handbook. Next step, integration of MCH handbook in the health system and involvement of private sector. Cost of printing and supply of MCH handbook will be included in the contract of implementation NGO after end of 2021. MCH handbook indicator are under process to be included in HMIS as well. Coordination with private sector related MOPH Directorate as well as private sector association at central and provincial level. Conduction of MCH handbook orientation workshop for private health facility staff in 2022. Technical support for implementing NGO during year 2022. Thanks for your attention. If you have any question, I am at service of you.
Well, thank you very much for your interesting presentation and sharing the progress of implementing the MCH handbook in Afghanistan, and also sharing with us the challenges you face for the implementation. And for sure there will be some questions for you, which we will try to answer and discuss with you later during the open forum. But before that, we first would like to go to the third country for the country report.
Yes, and thank you for not only sharing the challenges, but also the success story of the pregnant woman. It was very nice to hear the meaning of the MCH handbook for her. And I saw a question for you, but we have to wait till after the next country report of Laos,